Hi, I'm Stephanie Pope Singleton, a member of Charity Missionary Baptist Church. Think about the last time you were sick enough to go to the doctor. Was it easy for you to make an appointment that didn't conflict with your work schedule? Did you have to worry about how you were going to pay for the visit? Or how you were going to get to the doctor's office? Or if you could find someone to watch your kids? Could you find a provider you trusted or who looks like you and understands your cultural experiences? Over the past few months, our research has shown us that most people in the Tri-County struggle to get good health care because of three huge barriers. The first barrier is cost. In the Tri-County area, over 100,000 people don't have any kind of insurance. And in Charleston, where more than half of the people without insurance are Black or Hispanic or Latinx, it's clear that our healthcare system has not escaped Charleston's violent and shameful legacy of systemic racism. And even for those who are insured, getting to the doctor is often still so expensive because of high copays and deductibles. The second barrier is access. Even when people do choose to pinch pennies and seek out care, they are met with more barriers still, like doctor's offices and clinics that close at 4 p.m. or 5 p.m., conflicting with most regular work hours. Our limited locations that are hard to get to without a car, or no one to watch their kids during their appointment. The third barrier is trust. For people who aren't white, who want to see a provider who look like them and understands their experience, their choice of providers is limited at best. And for people who aren't native English speakers and want to see a provider with translation services, there are few options. We live in a community where it's easier to get sick than stay healthy, where our healthcare system profits from people being sick instead of being well, where people pay the price of being poor with their lives, where forces outside of our control deem who is worthy of healthcare and who is not. Enough is enough. It's been time for change. It's time for our community leaders to step up and take action.
Hello, my name is Paul Carswell, and I'm a steering committee member here on the Healthcare Committee with CAJM, and I represent Grace City Church. At the Nehemiah Action, we'll be asking for more mobile health units operated by the Fetter Healthcare Network in the Charleston area. You may be asking, what's a mobile health unit? Mobile health units, or mobile clinics, are essentially doctor's offices on wheels. With some added benefits, they can provide any number of services that you'd get in a regular doctor's office. Things like vaccines, primary care, labs, behavioral health care, and more. And more services are able to adapt their services to meet the community's needs. So first, why mobile health clinics? And why Fetter? Because investing in mobile clinics will address these three barriers we found in our research. We want Fetter to run them because they are already out in the community operating mobile health units. They just need more to reach the thousands of people who still can't access care. Let's review how they'll address the first barrier: cost. Fetter's mobile units serve folks with Medicare and Medicaid and people who are uninsured or underinsured. They provide primary care, medical homes, behavioral health services, vaccines, and more. They offer services on a sliding scale so that anyone can afford them. Now the second barrier: access. By bringing care directly to the communities who need it, most mobile units reach people who traditionally don't have time, resources, or energy to get to the doctor. Research proves that this works through the changes seen in the communities served by mobile health units. Life expectancies go up, and emergency room visits go down. And finally, the third barrier: trust. Mobile clinics are proven to build trust with communities of color and other medically underserved people because they bring care directly to the doorstep. The Fetter Healthcare Network has already worked hard to build that kind of trust with the people that they serve, and with more mobile units, they'll be able to build more relationships and provide more care. We will be asking for funding for these additional mobile units from MUSC. Our steering committee is working hard to nail down a specific target and dollar amount. Why MUSC? because they are a public hospital and therefore receive some state funding. Their mission is to serve anyone, regardless of their ability to pay, and what we've learned is that the mobile health units are a more effective way when backed by local health systems. We do want to acknowledge that there are thousands of healthcare professionals in the Charleston area who have worked tirelessly over the past year, putting their lives at risk every day to serve our community in the midst of an unprecedented global health crisis. We are so grateful for each and every one of you. Thank you. And at the same time, the COVID-19 pandemic has shed light on what uninsured people have always known about the healthcare system, what underinsured people have always known about the healthcare system, what poor folks have always known, what Black and brown folks have always known. That's nearly impossible to access solid medical care in the Charleston area if you are not white or wealthy. The good news is that our community has the opportunity to do something about this problem that will help both our community in the midst of the pandemic and get more people to the life-saving care that they need for years to come. We hope that MUSC will lean into this opportunity.